After months of buildup, the Trump administration began taking formal steps earlier this year to investigate Medicaid spending in New York. The state's healthcare program is one of the largest in the country, covering more than a third of New York's population, with the highest rate of spending per capita. It has long been a punching bag for critics looking to fling allegations of waste and abuse, some grounded in reality, and others not so much. Dr. Mehmet Oz, who leads the U.S. Centers for Medicare and Medicaid Services, asked for information about program integrity, screening, and oversight, with a focus on personal care, home care, medical transportation, and related services, with similar inquiries sent to California and Minnesota. For more on what this probe might uncover, as well as the broader room for cutting out waste, fraud, and abuse in New York's Medicaid program, we're joined by Carlos Cuevas, who is now a private advisor in the healthcare space as the founder of Safety Net Health Advisors, and he previously did a tour of duty as the senior advisor to New York's Medicaid Director. So, Carlos, I want to start with the status quo in New York and what you think of the current watchdogs on the so-called Medicaid beat, because we've got the Medicaid Inspector General, we've got the Comptroller's Office, there's a Medicaid unit in New York's AG's office, and I imagine other institutional forces that play some role in policing New York's Medicaid spending, and from time to time we do get press releases about improper costs that all these different players have flagged. So how effective do you think this existing system is in preventing the holy trinity of waste, fraud, and abuse?
Right. No, thanks for having me, David. Appreciate it. And I mean, to jump right into it, I think New York State actually has a very robust system in place. Everyone always likes to critique the one-off, but on a daily basis, when we look at the infrastructure we have, CMS data has actually shown that New York State has an improper payment rate of 1.43%, which is 3 times below the national average of a little over 5%. So, we have several structures in place, whether it's at the DOH within the Office of the Medicaid Inspector General, and a great team of fraud prevention for the Medicaid Fraud Control Unit within the AG's office. That said, there is fraud, waste, and abuse, and I think overarching people kind of lump them into one under one umbrella, but they are 3 distinct things. And it might help just to kind of like frame those things in terms of what we do and who deals with them. So there's, straight fraud, which is, intentional deception. That's when you are billing for a service that you never delivered. Right. And that goes, to the AG. There's waste, which is overuse, but not through like deception, but just maybe, we're doing more than we really, should be and necessary. And I think that's really, kind of in the realm of the regulations and policies that guide kind of the services we deliver. And that falls within DOH to either make better policies, improve policies, evolve policies. And then there's abuse, which is kind of like the practices that are inconsistent with sound financial and clinical practices. And that's where we have OMIG. And OMIG has a variety of tools to kind of identify things when they, when someone's overbilling more too much that rather, and that's kind of like, an abuse. And then, or like billing up. And then when it gets to really serious, that is serious, not just using a wrong code, but really deception. That's when they make referrals over to the AG's office. So we have a great system. I think it does very well, but we can always improve.
Well, you held up that low rate of improper payment as proof that the system is working. What about the idea that we're just not catching improper payments, and that's why the number is so low? If, for example, you're closing your eyes and ears to fraud, waste, and abuse, maybe you're just going to miss it.
Right. Well, New York has a very, very large and very intricate Medicaid program. I believe, we process over 660 million claims a year. And, we use that number but, it takes you around 11 and a half days if you were to use every second to count to a million. So you multiply that by 660 million, you really understand the vast undertaking that we have. And we are constantly improving. We are constantly using the latest technology to try to basically make our systems as efficient in catching these things as possible. But some of the framing that I think that, oh, we cover so many people and cover so many services and that all these costs, you know, that is basically waste and that is technically abuse and that falls under this large umbrella. I think our kind of we are using um data to basically make a political argument. And I
Yeah,
think,
I
yeah,
want to flesh that out a little bit more because one person's waste could also be viewed as this is an important use of spending for this person. They've gotten used to XYZ service or being eligible for XYZ service. And you could say that the waste is a reflection of policy priorities from stakeholders. So, how do you think about the line between when something is waste and when something is just, hey, we think it's important to cover this and to make it accessible to this population?
right. And that's really, a societal call, but the way that I look at it and, to kind of frame it, for example, you know, the Medicaid program, and through CHIP, which is the health insurance program for children,
Hmm.
usually covers children up to 200% of the federal poverty line, which is like the federal standard. New York, for example, covers children up to 400% of the federal poverty line. So there alone, we are going to, increase our system costs because we are just covering more people. But when you look at, you know, basically zero to three in terms of a child's development, okay, the mental health, the developmental health, the physical health of a child, that is an absolutely crucial time to make sure that we have clinical and behavioral health interventions to basically set the foundation for that individual's life and success. Okay, and some of these, a lot of these costs aren't much, but there are some that are really important. But if you intervene at that time and you give that child the proper support mechanisms, that really helps them not only have a rich life, but also enrich our society.
Well, I want to turn to the inquiry from Dr. Oz, and some of the areas that he is interested in are some areas that have come up over and over again in New York when people talk about Medicaid and maybe spending that we wish we could get back after the fact. And that includes something like transportation costs, that includes some of the personal assistance programs. So, do you think that state policymakers, the Hochul administration, is going to have good answers on some of those areas to federal officials, or are they going to be exposed for having systems that either invite abuse, waste, or fraud?
Right, right. And for those of us who listen to your show who might not have heard, but basically March 3rd was
Sure.
a big date. So on March 3rd, basically New York State received a formal letter from Dr. Mohammed Oz, who is the administrator for the Center for Medicaid and Medicare Services, which on the federal level oversees, our Medicaid program. And basically, that formal letter was to the governor, to our Medicaid director, to our commissioner of the Department of Health, as well as the Medicaid inspector general, basically asking, what do we do about fraud prevention and program oversight? And basically gave around 50 questions in a variety of areas. And basically, they have 30 days to respond. And, this is a formal letter. It is a serious inquiry. There has been research here. And so, the way that I look at this is, you know, New York has to have a serious and formal response. But I also want to say that this isn't the first time
Mm.
that, inquiries have come to New York State. I think under every administration, New York has received an inquiry. New York has a very large, intricate Medicaid program. And we ourselves look at our program, and the federal government looks at our program. And there's nothing wrong with that. However, what I do worry about is, hopefully we should always be working in partnership, whether it's with our stakeholders, our other government agencies, and government partners at the state, local, federal level. But, you know, if CMS does not deem our responses, from New York State, what that they receive on April 3rd adequate, there is a chance that they can defer payments. We saw this happen in Minnesota last month. They were deferred around $300 million in payments. We have a much larger Medicaid program. So we're talking this could potentially, hurt people in terms of our ability to finance services, those jobs. This can really impact people's lives.
Well, you bring up the fact that inquiries into New York's Medicaid program are not new, but I wonder whether inquiries that have been brought by, say, Democratic administrations to blue New York may have approached this with a less critical eye, or maybe were more willing to, wink at New York when they got their responses, as opposed to this administration, which has no political allies here in Albany's, seats of power. So could the approach from the Trump administration be very different in terms of how they digest any information from the officials you just mentioned who are going to be responding to this inquiry?
I'm not on the inside. I don't know, but yes, from my outside perspective, that's how I think. But there have been major, fraud cases brought during, okay, and raised by our AG and executed and brought on by research that happened under federal Democratic administrations. So I don't fraud, fraud is something that even the governor has said recently, if it's about getting rid of fraud and whatever we can do and whatever we can get in place to make sure less of it happens and hopefully that we are able to eradicate it, New York State she is fully supportive of. Now it's how we go about building a better program. And I think, penalizing and really, cutting funding and cutting care really only hurts the individuals and the communities that need it most. There's a way to approach change. There's a way to evolve. And, that's really what I'm concerned about. Not, if there's fraud, yes, I'm sure there is some amount of fraud. Do I think with a $100+ billion program, is it the runaway fraud that people think that there is? I think more of it, as we say, is like the waste and abuse and how do we make the system more efficient. But if we want to focus on, eradicating that small percentage of, fraud that's out there, yes, let's put better systems in place. Let's work together.
And after a quick break, we'll continue our discussion about the Trump administration's inquiry into New York's Medicaid practices with our guest, Carlos Cuevas, who is a former senior advisor to New York's Medicaid Director and is the founder of Safety Net Health Advisors.
Support for the Capitol Press Room is provided in part by the Lawsuit Reform Alliance of New York. Fraud and lawsuit abuse impact car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. Information on these reforms is available at keepnewyorkaffordable.org.
This is WCNY's The Capitol Press Room, and we're continuing our discussion about the ramifications of a federal inquiry into New York's Medicaid practices with Carlos Cuevas, who previously served as a senior advisor to New York's Medicaid Director and is the founder of Safety Net Health Advisors. When thinking about the more immediate outcomes of this increased scrutiny of New York's Medicaid program, my cynical brain returns to The Wire, the HBO show, and how anytime there was pressure on the police to show some action, they ran out, made some street-level arrests, didn't really do anything of significance, but they had quote-unquote dope on the table. And I wonder if there's a parallel that we might see here in New York by some of the regulators in the Medicaid space, and whether they might be having some sort of ripple effect on the different stakeholders, like the providers, like the middlemen in the system, who are going to be now have to fill out paperwork in triplicate or explain themselves for the second or third time. Do you have any sense of what that might look like, or am I too cynical to think that they might just try to have some sort of immediate scalps, so to speak, to show that, oh, look, no, we are doing a great job?
Right. I think in New York's response, they should really lead with their statistics. Okay. And I believe the statistics show that we do a good job of basically mitigating fraud, waste, and abuse. Right. I think, there's something called the electronic verification system, the electronic verifications, where, we are using basically electronic reporting to report like time, location, and the identity of the person used in service. This was part of the I believe like the 21st Century Care Act, and so this has related. It's been implemented in 2020, but it came to basically like home health services in January of 2023. New York State has rolled that out. I hope that we are able to use that kind of AI and other technologies that we have to basically wart fraud and wart waste and help us even identify potential abuses or things that are, using large amounts of data that we have to kind of identify things quicker, flag things, and use that rather than more paperwork. We have excellent providers, but our providers want to help the patients and those in need. They don't want to be doing more paperwork. And I think government, right? It's kind of what are the programs and the policies and the procedures that we can put in place to secure our system, okay, without adding more red tape.
I've read one analysis of the potential responses to this inquiry being that we'll see increased enforcement from that Medicaid fraud control unit within the state attorney general's office. And as sort of a backdrop for that, Bill Hammond over at the Empire Center for Public Policy highlighted how few investigations this unit does relative to spending on Medicaid. It was 8 investigations per $1 billion spent, which was the third lowest rate among the 50 states and 63% below the U.S. average. So what do you think about, one, the idea that the fraud unit may increase its presence in the wake of this inquiry, and two, what do you think of the idea that there is probably room for them to be more aggressive?
Right. First of all, really appreciate and respect Bill Hammond. I think he's one of our best healthcare analysts, and we're very lucky to have someone like him in New York State.
I feel like there's a but coming.
But I think it's again like the way we look at it. So Bill's information is not wrong in terms of right. So fewer cases, but the flip side of fewer cases is that the cases that that unit goes after are usually much larger. So it isn't just the number of cases, but the intricacy of those cases, the size of those cases, and really going after, right, like the large whales, the egregious, to put things on. Now, for that, I mean, if we wanted to increase the size, again, I don't want to play Monday morning quarterback because I'm not there. I'm not, inside, but we could, potentially increase the units, at the AG's office looking into Medicaid fraud. We could increase, the budget for OMIG so that they can, buy, as we said, these electronic tools and the latest technology to flag things sooner, to send more cases and to send them faster to the AG's office. But I'm on the outside now, but as a former, government employee, we have some brilliant, dedicated civil servants who are operating at the highest levels, really mastering, highly technical cases and work. And so, again, I think we have a record saying, there is fraud, waste, and abuse. We do look at it. When you look at the Muhammad Oz citing, there was a $68 million case, right, of Medicaid fraud that was by RAG under a Democratic administration that we internally looked at and we have prosecuted and then shored up after that.
One of the tools that New York has to prevent bad actors from existing in the Medicaid space is the exclusion list. Do you think that's an area where the state could be either more aggressive in terms of who gets onto that list as a way of preventing fraud?
Yes. I mean, I don't think there's one silver bullet. I don't think there's one panacea, but I hope and I know that this inquiry, on top of everything else, will make New York State reevaluate what are we doing and what can we do better and what else can we do. I'm also looking forward to, right? I mean, this fraud, waste, and abuses has kind of been a campaign for this current federal administration.
Sure.
And basically, there's this RFI, request for information, out called, Crush, which I think is like comprehensive regulations to uncover like suspicious healthcare or something, Crush. But basically, they're asking for information on how can they, like reduce, detect Medicaid fraud, right? And so there's an RFI. If you have thoughts and ideas, you can submit something by March 30th. And I think, CMS, in partnership with states, in partnership with our Omega, et cetera, will work together to say, hey, what are the best practices and how do we implement them? With one of them, again, being using these lists.
Well, sticking with waste specifically, the governor has made the case that the changes that she spearheaded with the Consumer Directed Personal Assistance Program have rooted out, I think, $1 billion annually in waste. And I'm curious whether you think there are other programs that might be ripe for the same type of review and overhaul in the Medicaid space that could generate some meaningful savings.
Right. Yes. I mean, I think that there are plenty. I think, with the consumer directed programs, you know, that is a program that has to tightly be monitored, right? Because we're talking like 15-minute increments. We're
Mm.
talking, it's easy to just add, an extra 15 minutes here, an extra 15 minutes there. So I think we do a good job, but we constantly have to evaluate there. Medicaid, for example, spends close to $3 billion on transportation.
Right.
Okay. I don't think it's, fraud, waste, and abuse, but I think, $3 billion on transportation, that's an area that we have to really critique. But people don't understand, New York is a very large and very diverse area, right? We have New York City, we have urban areas, but we also have North Country and very rural areas. And that, medical, non-emergency medical transportation is a vital resource to keep people extremely healthy, in those areas.
Well, you say extremely healthy, and this makes me think of
Right.
the
Yeah.
outcomes, though, because I think a lot of people would look at New York's health outcomes and say, not only are we spending more per person on Medicaid, but there might not be evidence that those people are getting the best bang for their buck. And when New York, in terms of that population, isn't as healthy as they could be, but maybe there's evidence to the contrary, because in some cases, New York more broadly has some good health outcomes.
Right. I think it's, good point, right? The data points to that. And I think, part of the evolution that we have work towards is really, we're dealing with, acute episodic care. And more through the waiver, through the New York State 1115 waiver that we have that allows us to pilot, right, demonstration programs in
Hmm.
terms of service delivery and financing. We're really able to treat a person more holistically and really looking to bring providers together as integrated delivery systems. And I think that's kind of the next iteration and how we are going to work to keep people healthier, right? So if we're treating people acutely instead of like holistically working on their clinical, behavioral, as well as social needs, I think that's where we will really end up keeping people as healthy as possible. And I don't think now, because of rules and regulations, even the federal government around a decade ago, you couldn't use medical dollars really for anything that was non-clinical, that was, social service related. More and more we realize that basically it's these social determinants of health or social drivers that really impact someone's health. So the food, well-being, environment. And now we just, with the waiver, we're really starting to integrate those providers together and the financing together. And hopefully we will see better outcomes and better, efficient use of our dollars with this type of holistic care.
Is one of the things that the state could do to ensure money is being spent the way it's supposed to be under existing rules and regulations would be to help providers with compliance instead of making them be responsible for a lot of this work, maybe beefing up our own help desk, so to speak, increasing the FAQ responsiveness so that people don't feel like they're necessarily navigating this Byzantine system on their own and potentially making mistakes that lead to waste?
In short, yes. I think, the government really tries to. So anytime, several times a year with the waiver or with other programs, right, there's public comment periods. There are different, committees, commissions, and panels to really make sure that, the state gets feedback, from the public, from those in the trenches. But, obviously, as we evolve, as we're creating these programs, you know, I I think, the most important thing we can do is we need to create policy that is flexible, that can be implemented in both urban and rural areas, that allow us to deliver culturally competent care. And when we try things and things work but not perfectly, we have to have the flexibility to really alter so that they're more responsive to what we're seeing in the actual communities.
Well, we've been speaking with Carlos Cuevas. He is a former senior advisor to New York's Medicaid Director and now private advisor in the healthcare space as founder of Safety Net Health Advisors. Carlos, thanks so much for making the time. I really appreciate it.
Appreciate it. Have a good one.
Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.